So stepping into the first element, we're asking you to think about your people, to know your context and know your community. The first piece of research that I will draw your attention to from an occupational perspective is the work that's being done by Martina McGrath. And I'll drop a link to her research or the most recent publication from Martina. And that's to say we have to be thinking about why and whether people disclose suicidality and mental health problems within a workplace. What are the factors that actually inhibit that? So to start with, you need to be asking questions about your people. What does your service workforce look like? How often is the workforce exposed to suicide? Now, this is an important question because the repetitive potential experiences and hearing the stories of the service staff or the employees around that service will tell you about their beliefs. If you hear stigmatizing, discriminatory, dehumanizing commentary around that, that will give you an indication of whether or not they are ready and prepared for a postvention response within the service. What's the messaging that our leaders and our peers share about suicide? This might be some of the first work you need to do to challenge the stigma or the discrimination or the perspectives. It may be one thing to respond to your client group who present with suicide, but what does it mean if somebody was to disclose suicidality or mental health challenges within the workplace? So the questions are about workforce culture. How do they care for others? Does your service take brave steps to tackle some of those wicked problems? And how big a gap does the service have between frontline work and the executive leadership? Now, this is important because when we go to stand up an immediate response, if that staff has said, I need this training, I need this support, I don't have enough about suicide prevention responses, and then we see a death occur, the resentment held by that frontline staff member to the executives who said, no, we don't have funding for that training, will be a barrier to how effective that postvention response will be. Can people be authentic and own their experiences about the workplace? Can they share their problems? And then the final question is another really important potential point for learning. Has your service been impacted by a sudden death, a missing person, or a suicide in the past? And what did you learn from that? These questions allow you to say, okay, the immediate response was really well done. We had an external provider came in for a week, really well done, but after a week it was lacking. These are the learning points that we take in our preparation and preparedness phases. We then need to have some really deep understanding of the context in which a postvention response will be rolled out. If you're working with a community, it is not a postvention response that's internal to your service. You may find that there are other organisations already developing and providing a community-based postvention response. So you think about standby support after suicide, for example. In that space, though, if you are going to link into that or work with those groups, you need to know about the diversity, the cultural and religious perspectives of the community to know what kind of messaging will be required. You also need to think about the social and economic environment, the political environment. What does that mean for how we communicate? And are there resources that might be released if it's only a disclosure of suicide but might be held back because the families say, I don't want to say it's suicide, I want to say that it's just a sudden death? How can we make allowances for groups who might say, I don't want to disclose it's suicide, I can only feel comfortable saying that it's a sudden death? Is that prohibitive in terms of resource allocation and funding release? And then finally, who are the decision makers that you need to have on board? You need to appeal to these decision makers to be a part of the response that you're looking to be involved in or you're looking to stand up. As we know our community, you have to think broadly about what the community profile is, the demographics of the community, the different pockets of diversity, that sort of thing. What's their knowledge about suicide-safe communications, and what are your existing suicide prevention activities to build the awareness around what is safe communication? If you have a relationship with a service which has been rocky, and you think about a rocky relationship between two services, how might that impact a postvention response? How do the community members prefer to communicate? And you might have a youth response about to stand up, and you know that social media is a really effective way of communicating. But if you're looking at older persons, what types of communication strategies do they prefer? And it may be that you find it's a face-to-face community hall type gathering. What traumas has your community needed to face prior to this event? What's the context in which the postvention is rolling into? If you're thinking about bushfire, flood, pandemic responses, all sorts of things, this might actually mean that people are fatigued and we have to simplify what we're doing and how we're doing it. Importantly, if the community has had significant levels of stigma and discrimination around suicide, around LGBTIQA+ identification, around any number of other elements, how are you going to acknowledge that in your postvention response? So in developing your plan, what I'm asking you to do is think about the co-design process. So you need to stand your rapid response up within 24 hours. That's what our timeline is going to suggest. We need to be standing on the shoulders of existing, strong, trustworthy relationships. This is the stuff that postvention planning rarely talks about, but we have to be stepping into this space of repairing relationships that might have been fractured due to other factors. If we want an immediately effective postvention plan, we must work to maintain that trust. And for a localised, fit-for-purpose resource, we need to be co-designing this with the people that we hope will engage with our service.